Hello, ma'am. We are live. Good to go.
Yes, so let's be muted. Okay.
Likita, we can start.
Okay, we are good to go, are we?
Yeah, we are good to go.
Okay. Good afternoon, everyone. Hope you all are doing safe and are in great health. On behalf of the Indian Pharmaceutical Association Community Pharmacy Division and the Indian Pharmaceutical Association Student Forum, I would like to welcome everyone and thank you for being a part of this webinar. This webinar, entitled Embracing Digital Opportunities in Community Pharmacy, is brought to you by the IPA Community Pharmacy Division under Go Digital Initiative. I would also like to warmly welcome our guest speaker for today, whom I'll shortly introduce to you. Go to the next slide, Yogi. I'm Likita Tadituri, Joint Secretary at the IP Student Forum and the moderator for today's webinar. Firstly, I request you all to be conscious of the following housekeeping rules. Please keep your microphones muted. If you have any queries and questions to ask the speaker, please post them in the chat box or the Q&A box. We'll try our best to answer them during the webinar. Do fill the feedback form, the link for which will be posted in the chat box towards the end of the session. And if you're watching this in YouTube Live, the link will be posted in the description. Please do check it out. And I encourage you all to become a part of the Indian Pharmaceutical Association to avail the wide range of benefits and also contribute for the cause of pharmacy profession. You can visit our website ipapharma.org to know further details. Also, do follow us on our social handles at the rate IPACPD and stay updated on the recent happenings and activities. Next slide. Rapid developments in digital solutions have revolutionized health service delivery from prevention to diagnosis, disease management, and monitoring. Pharmacists must keep themselves updated on all these emerging advances, which will reshape the future of pharmacy. This webinar aims to make the participants understand what are the various exciting digital health opportunities in community pharmacies and how to utilize the digital technology for enhancing patient care and improving business in the pharmacy. I would now like to call upon Mrs. Manjari Garad, Chairperson of IPA Community Pharmacy Division, to give the opening remarks for today's session. Over to you, ma'am.
Thank you very much, Likita. And on behalf of Indian Pharmaceutical Association, again, I welcome everyone. Thanks for joining live, and thanks to those who will be watching this webinar later on the YouTube. A special welcome to our guest today, Mr. Jaime Acosta Gomez. I would like to, before we go to the exciting webinar, I would like you to get introduced to Indian Pharmaceutical Association Community Pharmacy Division, as we call it IPCPD, and Indian Pharmaceutical Association Students Forum, IPSF. I'm sure many of you are already well versed with IPA, but for the benefit of those others who are not yet well versed, I will just go through some of the highlights of IPACPD and IPA. So the Indian Pharmaceutical Association is the oldest pharmacy professionals association in the country, established way back in 1939 in Banaras Hindu University, BHU. So this is the oldest premier association, as I told you, and IPA now operates in India, all across India, through 20 state branches and more than 46 local branches. We have a great team. So we are representing IPA Community Pharmacy Division. And there are other divisions, like, can I go back to previous slide for a second? Previous slide. Okay. Where did we go? All right. So I just wanted to tell you that, yeah. So we have 5 divisions under IPA: the community pharmacy division, which we are representing here, the industrial pharmacy division, the hospital pharmacy division, IPA education division, and IPA regulatory affairs. And apart from that, we have IPA students forum. So now we go to the next slide. So I would love to show you the team that we have under community pharmacy division. It is a grand mix of community pharmacists, the practicing community pharmacists, pharmacy practitioners, pharmacy academicians, as well as digital health experts. Next. So under IPA Community Pharmacy Division from last several years, actually I can tell you that IPA Community Pharmacy Division is the youngest division of IPA, but it's most active, most vibrant division of IPA. And we have several collaborations because we work in variety of sectors, variety of areas, from good pharmacy practices, accreditation of pharmacies, to the IPA, to the public-private partnership programs like DOTS TB Pharmacist project. We also are very active in consumer medicine education, and we have created various resources for the lay people to educate them about responsible use of medicines. And we have variety of training programs, continuing pharmacy education programs. Earlier, we used to have it face-to-face. Now we have it through a digital mode. So we have collaborations with FIP, the CRPharm Forum, Government of India, Pharmacy Council of India, and large variety of the pharmaceutical companies. Next one. We have, as I told you about the ongoing activities, we also have a lot of activities in pipeline, some of which we have just started and some of which we are planning to begin very soon. So one of them, the major ambitious project or the activity is antimicrobial resistance, so AMS campaign. Then also we'll be soon taking up a campaign on diabetes mellitus. We have some plans for pharmacy practice research, in which in this area we haven't done much, but we are ambitious to do it. Then we want to develop a lot of training modules for the pharmacists, and we also want to mentor the pharmacy students. And that's why we are always closely working with IPA Students Forum, because they are the ones, they are the future of the profession. Next one. Next slide. So now I introduce you in brief to Indian IPA Students Forum. So this is again established. Yeah, please go ahead. Next slide. So IPSF was formed on August 16, 2008, and this was a historic event because it was inaugurated formally launched in presence of former President of India, late Dr. APJ Abdul Kalam. Next one. And so they have a well-defined structure with the executive committee officers, and they have state branches as well as college chapters all across India. So I invite you to join hands with IPA-CPD and for IPA-SF. So we have IP at IPA-CPD and at IPA-SF.org. So LinkedIn connections, and you will be entering, the profession. If you are connected to us, there will be the sky's the limit for your learnings and for your professional developments and professional achievements. So please join us. And now we are going forward to listen to our speaker for today, Mr. Jaime Acosta, whom Likhita will be introducing you formally. But I can tell you from my experience, I know Jaime. He's my colleague from FIP Community Pharmacy section from last several years. More than a colleague, he's a close friend. And I haven't seen a very passionate pharmacist like Jaime anywhere in the world so far. He's he's tech savvy, he's knowledge hungry, he's got great leadership qualities, he loves innovations, and more than all this, he's a very humble and kind human being. So very happy to have you, Jaime, and thank you for accepting this invitation in spite of your busy schedule. I know you are sitting in the pharmacy and you're going to deliver this webinar for Indian pharmacists. So thank you again, and over to you, Likhita.
Thank you, ma'am. It is now my immense pleasure to introduce to you our today's guest of honor and the speaker of the session, Mr. Jaime Antonio Acosta Gomez. He is a community pharmacist and pharmacy owner at Madrid, Spain. He is a member of the International Pharmaceutical Federation Community Pharmacy Section Executive Committee member. He is the member of the FIP Technology Forum. He is a member of the FIP COVID-19 Expert Advisory Group, and he is a comptroller at Heping, a Spanish drug wholesaler. and is a member of the Governing Health Futures 2030, the Lancet and Financial Times Commission. As an experienced community pharmacist, Mr. Jaime has played a significant role over many years on different levels, representing community pharmacies' interest on a local, national, and an international level. Mr. Jaime has a strong passion for future of pharmacy and a deep understanding of the community pharmacist environment and healthcare's new and changing needs. His leadership and skills have been recognized twice by the World Health Organization with WHO Armstrong Institute of Johns Hopkins Medicine Scholarship in 2013 and the WHO Scholarship Grant for Upcoming Leaders in 2011 and very recently with the FIP Fellow Award in 2020. Sir, it's an honor to us to have you with us in this session. Now I would like to pass on the floor to you. Over to you, sir.
Thank you very much for this very kind introduction. Thank you, of course, to the Indian Pharmaceutical Association, Community Pharmacy Division, and Students Forum for this invitation. It's my honor and pleasure to be here with you. Just briefly, I would like to salute Ms. Manjiri Garan. She said she's a friend of mine. And very briefly, I have to say that she's an astonishing professional and very excellent human being. And I won't forget the first time I saw her speaking in an FIP conference. I was thrilled. I can say that you're very lucky to have her in the leadership. And she is shining in the FIP, as you know. Also, a special mention to Mr. Raf Baidia, who's working with the community pharmacy section of the FIP. And it's a pleasure to be working with him. Thank you for investing some of your very valuable time to listen to my presentation today. So going into the presentation, I will try to talk about the digital aspect of caring of people. I won't go into many details of how technology is a worry for community pharmacists around the world. No wonder, because in most of the strongly still depend on the sales or dispensing of products. And we are worried that this tech international companies will provide the service that we are providing now to patients in terms of dispensing and supplying of products, because we will be in big trouble if we are substituted by these companies, which are experts in disrupting industries, as we are aware with many other industries. I will try to put my focus on how technology can help us to provide a better service with more quality to our patients, to our customers, and put some practical examples. This is not an academic presentation. I just thought that it would be nice if you could see some of the examples that I have liked from what I've seen around the world. So we will talk about telepharmacy. This is a very mature technology that it's already in use in many countries in the world. Bots that, as with other digital health technologies, saw a big ramp up during this very sad COVID pandemic. Some examples related to artificial intelligence, which is very much related to bots, and how I see what the future might bring to us in pharmacy, and what opportunities are there in front of us that we should embrace to provide, as I said, a better service to our patients and customers. So just as a beginning, just to let you be aware of how important these technologies can be, this a report from Dr. Topol, who's an American physician who was commissioned with a report from the British National Health Service. So they listed in that commission some of the technologies that might be used in the future, or are already a reality in the healthcare practice. And they put this image that I like very much, because it shows how fast and deep the change are going to come into healthcare. But just, I won't go into the details of this, but just one of the findings of the report, one of the conclusions was that 90% of all jobs in the National Health Service will require some element of digital skills. We should all, in the pharmacy setting, become digitally competent and confident, because these are the tools that we are going to use in the very close future. Just as a first example of telepharmacy, we're all aware of what telepharmacy is, but I wanted to bring you this commercial from a private insurer in the US, and how patients are already taking advantage of this service that brings not only convenience and efficiency, but also quality.
Remote dispensing software integrates with pharmacy management systems. Look at how a telepharmacy works in 4 simple steps.
So this is a shop in a rural village in the United States of America. So
Prescriptions arrive
a
at the telepharmacy
very small
electronically.
town. They do not have a pharmacy. They have a shop with someone trained to work in a telepharmacy scheme. So this technician, who's previously very well trained, receives the patient, who can bring his prescription either with a hard copy, paper copy, or can be provided by fax, as they do in the US. They do use fax, or maybe the prescription can be transferred electronically. I want to bring your attention to one work we're doing in the FIP under the leadership of Ms. Madrid. We are exploring how e-commerce is going to affect pharmacy, not only in terms of how they are going to affect brick and mortar pharmacies, but also what issues they bring for patient safety. So going back to the case, the patient comes, the technician puts the prescription
into the system, which is
and then it's
verified
verified by the pharmacist.
The technician and pharmacist can easily communicate via secure connection at any time. Telepharm's remote dispensing software integrates with pharmacy management systems for a seamless, real-time experience. After the pharmacist verifies the data entered, the technician prepares the prescription for...
So everything is recorded?
The technician captures high-quality images of the prescription, prescription label, physical drug, and medication bottle for the remote pharmacist to review. A telepharmacy operates like a traditional pharmacy, except the pharmacist reviews prescriptions and counsels patients from a remote location. The pharmacist reviews the prescription by analyzing images sent over by the technician. They also reference the patient's medication profile for drug interactions and other potential side effects. If approved, the technician places the medication in During counseling, the remote pharmacist has all necessary patient information. Questions.
So as you could see, this brings, as I said before, some advantages that I would like to mention. First of all, the efficiency. So this there's no pharmacist that of course has to be paid, but there's always a pharmacist available through this. All the process is recorded. So if an error or a mistake or a problem occurs, all the process can be reviewed, not only the supplying process, but also the information that the pharmacist provided. And again, in terms of quality, the pharmacist follows standard operation procedure. which is very different to what I'm doing, for example, in my pharmacy now. So I have a conversation with my patient, but I might not follow some important steps so there's no recording of what happened if a mistake occurred. So the pharmacist is always available for the patient, not only when the patient has a prescription, but also there's a screen available in that shop. So any patient or customer can ask for an interview with a pharmacist. So this is one of the technologies that, as I said, is very mature. For example, in an FIP conference, we had a lieutenant from the US Navy, and they put this telepharmacy scheme available for all soldiers all around the world, because every time that a patient needs a medicine, they always have a conversation with a pharmacist first, and the pharmacist might be thousands of miles away, of course. So they can have a consultation even in a submarine or in a Navy base in the opposite part of the world. So another technology I wanted to talk to you about, this private company called Babylon. And they have these three more important business models. The first one is they offer the chance of offering their customers 24/7 access to a physician through their smartphones, and the physician can have face-to-face conversation while the physician has complete access to their medical health record, which is again an added value to patient safety and to the efficacy of the prescription that the physician might issue. But what I find also important for the pharmacy business is that once the physician issues a prescription, it's not the patient that decides what pharmacy she wants to have it picked from or dispensed. It's this company that offers delivery from the pharmacies that have an association with the company. So you can be the best pharmacist, you can be really up to date and eager to help patients. Your pharmacy can be very well stocked with very good prices. But if you are not in association with this company and other companies alike, you won't have any business. This is why I think it is very important that pharmacy should offer these tools to patients. Otherwise, it would be other people that would offer them to patients just for their own private profit, and will be a part of this market. Another scheme they offer to patients is the chance of talking texting with a robot. In this case, this robot offers personalized advice about sport, nutrition, and mood. As you can see in this screenshot, they offer personalized advice. But what I find most interesting is that they offer triage under the National Health Service. So the patients text with the robot and they receive an advice about their health concerns or symptoms. And it can be very complex. So just for you to see how it works, I registered in the platform. So the robot, before I consult, knows my age, my gender, my weight and height, first information of me. So I texted as if I had a breathing problem. So this is me typing. I'm talking with texting with the robot in my own language, as you can see. So the robot asks if it's for me or for anyone else. So I select the right option. This is not the replacement of medical diagnosis. Always this, in case there's a problem, they don't want to be sued. The robot checks that I have difficulty breathing and how difficult it is for me to breathe. And you can see how the robot goes descending, trying to understand how bad I am to offer the best possible advice. Maybe going to a GP or going to accident and emergency, or sometimes going to the pharmacy. So I'm trying to do it as short as possible. I always selected the baddest of the options. In this case, just I select that I get out of breath just talking or getting dressed, not walking normally or walking quickly. Again, the baddest of the options. So my symptoms are staying the same. Do I have any other symptom? Yes, I am coughing. So, of course, after you can see that how this works, the chatbot suggests me going to an emergency department. Of course, no one in my case would probably go to text with an app in their mobile phone. Maybe they could, but how this works, and I did not have to go to a hospital. I did not have to go to a pharmacy. I did not have to wait for an advice for maybe 6 or 7 days before my GP had an appointment available for me. And this is so cheap to run. It's very expensive to build, but once it's ready, it needs volume, a lot of patience, because it's very cheap to use, and also it needs more data. So the algorithms improve. Just a very small example of how technology is evolving. Maybe we should use these tools in our pharmacies, offer these chatbots to our patients. This is another example from a Chinese company. It's called Ping and Good Doctor. It's in the Hong Kong Stock Exchange market. And they are specialized in digital health technology, and they developed this booths that they called 1 minute clinic. So you can see it's divided in two. Here, the patient gets and conversates verbally with a chatbot. They do not have to text. In this case, it's improved. And this booth offers the chance of adding some medical devices as to measure blood pressure, or to measure the glucose blood levels, or maybe an spirometer to assess the breathing of the patient. Of course, everything should be COVID safe, but it's a possibility. And in the other part of the booth, they have 100 products in stock that if the chatbot decides that they want to, that the patient needs maybe a medicine that can be prescription medicine or not, the patient immediately can have it serviced in the other part of the booth. And if they do not have in stock the product the algorithm thinks the patient needs, they can be referred to the closest pharmacy that has the product in stock, or it can be delivered to the convenience of home or work or wherever the patient wants it to have delivered. And again, the pharmacists around, they might be the best pharmacies in the world, but they are not. They're out of business if they do not have an association with this company. And as you know, in China, they are having a huge trouble with healthcare workers shortage, and healthcare is getting more and more expensive. And this is like a democratization of healthcare advice, and they want to put this concept booths in stations, airports, and malls. And they are in association with 60,000 healthcare clinics and more than 3,000 hospitals. And this is a big number. And also, as you know, in China, data protection regulation is not as tough as in other countries, and they have the very big volume of a lot of people that need access to healthcare. So they're going to have more and more information, more and more data to feed the algorithms with, and these technologies are going to become better and better all the time. And of course, I could not talk about digital health without mentioning Amazon. As you know, Amazon is finally going into the pharmacy market. We're allowed, for example, in the US. And it's not the first step they took, because 3 years ago, they bought this company called PillPack. Interestingly, they're going to keep PillPack for more complex patients and Amazon Pharmacy for not so complex patients, because PillPack, what they do, they deliver those aids. They do not deliver the full box of a medicine, but they put the medicine in those dispensing aids. So the patient just have to open this sachet at 8 a.m. on Sunday, and they have all the medicines they need for that have been previously reviewed by a pharmacist. So they deliver these sachets to the convenience of the patient's home. So they're going to have these both brands, Amazon Pharmacy to maybe patients that use 1 or 2 medicines, not more, and PillPack for more complex patients. And pharmacy business is a business that suits Amazon, because it's not logistically very complex. The parcels are not big or heavy, and patients need to buy the same thing from time after time. So it fits very well into the business of Amazon. But they are also going into digital health. As you know, this smart mic, as we call them in it's called Alexa. And as you know, Alexa is all the time hearing conversations. So they offer their advice. Maybe if the patient needs to have a new box of medicines, they need to have more medicines dispensed. They simply talk with Alexa and say, Alexa, I need my blood pressure pills. I want them to have delivered, please. So Amazon takes care of everything after that. And the patient receives the medicine with Amazon Pharmacy the day after the patient requests for medicine. And they also have a scheme available by which Alexa asks if they have had their medicine, just to be sure that that the patient is adherent to treatment. But there are some little bit more complex things. This is a patent filled by Amazon. So Alexa, when listening, they can detect if the patient is coughing or sniffling. So they immediately know that the patient, the customer might have a cold problem. So they ask Alexa, in this example, they ask the patient for a recipe, suggest giving a recipe for chicken soup. No thanks. But what Alexa says, okay, I can find you something else. By the way, would you like to order cough drops with 1 hour? That would be awesome. Thanks for asking. No problem. I'll email you an order confirmation. Feel better. So this is the moment of truth for selling things, for selling products. And Amazon is taking this as a marketing tool. It's very different to sending emails or putting banners, which maybe the patient or the customer does not need that product at that same time, but they detected a need and they offer very easily for the patient, for the customer to have a product delivered. If you compare this to the regular practice, for example, in Spain, this patient should come to my pharmacy to have it open, that I have it open. Although I open from 9:30 to 9:30, it's 12 hours from Monday to Saturday. This might at 11 in the night. So she will have to come to my pharmacy, wait for a line, talk with me when everybody else is listening to what she is saying. And of course, I'm an expert pharmacy, and I would offer the best product available that I have if I think she needs it. But it's so different to what is happening in these images, as you can imagine. Just 1 hour delivery after the patient needs it, without leaving her home and not doing anything else, just having a conversation with Alexa. And they are also Amazon. These big companies enter into healthcare by two things. First, they begin developing products for well-being, not healthcare, which is much more complex and difficult also in terms of legal responsibility. But they begin developing products as counting steps and helping with maybe sleeping disorders, all these kinds of things. And then they enter into healthcare once they have developed this expertise. And other thing they take advantage of is the big number of employees they have. As you know, in the US, is the employers that provide insurance to their employees. So this is a perfect situation to develop products that can be after that taken outside their company, as it has happened with Amazon Care. Amazon Care is a tool developed for their employees, and they have it's a telemedicine tool, and they can chat. Employees can chat with their physicians and offer other advantages. And now they are offering this tool to any other company in the US that wants to use it by paying a fee, of course. So this is another way Amazon is getting into healthcare also by using technology. So I would like to share with you a potential example of how I think healthcare might be in the future. So imagine this is Jean in the center. She's a lawyer. She's diabetic, and she uses an app that helps her to manage her diabetes. So she has a patch that is already in the market that measures 24/7 her blood glucose and sends the data to this digital tool. So this tool advises Jean nutrition, and sometimes even if to their physician in changing the insulin dose. So one day, this tool sees a funny change in the regular blood glucose levels of Jean. And because the tool is used by thousands, hundreds of thousands of people using this data, this tool thinks that Jean might have a potential urine infection but by this slight change. And this is what big data is all about. They find a direct relation with things that previously might be impossible to think. So in this case, this digital tool detects that Jean might have an urine infection. So what this tool does, they send an alert to this smart water closet. So when Jean wakes up, the first thing she does, of course, she turns on her phone to a toilet, and she has her urine automatically measured. They measure the color and the pH without even Jean noticing. So after this very simple test is done, and this is already in the market too, all these examples are already available, but I allow myself to connect them just to provide you with this example. So there's again a small change in Jean's urine. So it is suggestive of an urine infection. So this smart water closet sends an alert to the smart mic that Jean has at home. And the smart mic says, Jean, I think we think that you might have a health problem. Are you feeling good lately? Did you have fever? Do you have any problem when you go to the toilet? And after having this, again, very simple conversation without any human interaction, the algorithm thinks that yes, after all the data that they have that has been shared with it, that Jean might have an urine infection. So the smart mic says to Jean, I think that you might have a problem with your urine. No one has said yet to Jean that she is having an urine infection, because this is a diagnosis. And for the moment, machines are not allowed to diagnose. So in some jurisdictions. The smart bank says to Jean, would you like to have a telemedicine interview with a physician? And Jean says, of course, yes, I would like to have an interview with a physician that connects immediately through her smartphone or through her television. And they have a distant face-to-face clinical interview. So the physician, after having this conversation with Jean, thinks that yes, she might have an urine infection, and he sends a test, a medical test, in this case, very different to this very simple one that Jean had at the beginning. And he sends it, and Jean has it delivered maybe in 20 minutes, either by regular delivery or maybe by a drone. And Jean does the test with her urine again, and the result is immediately uploaded to the physician. This is a medically approved test, and the physician sees the result. And he connects immediately with Jean and said, Jean, I'm sorry, you have an urine infection, and I think you need an antibiotic. I'm going to issue a prescription to you. But in this case, instead of sending maybe a prescription through email or putting the prescription in the electronic health record of Jean, so she could go to a pharmacy, in this case, this prescription is authorization to the 3D printer that Jean has on her home, as it will happen in the future. Everyone will have a 3D printer in our homes. And the printer prints 300 milligram pills of ciprofloxacin. And this is different to the standard dose in Spain, for example, that Jean would have 250 milligrams, because the physician has checked Jean's profile, and he has seen that Jean has a problem with ciprofloxacin, and her blood, her liver cleans the antibiotic faster than a regular patient. So he orders 300 milligrams of ciprofloxacin instead of the regular care. So again, if you compare this to what would have happened with Jean in the current care, so Jean would have waited maybe 2 or 3 more days until she had worse symptoms. Then she would have waited maybe 2 or 3 more days to have an appointment with her physician, and she would have to go to a pharmacy and again wait that the pharmacy is open, and expect the pharmacy to have the medicine in stock. Maybe she would need to return, and she's a very busy lawyer, for example. This is super inconvenient for her, apart from that when she receives the first dose of the antibiotic, her infection might be way worse. And you can also put this example a little bit more complex, because there are smart watches available already, experimental, yet not in the market, that measure drug blood levels automatically. So if Jean skips a dose, the physician would immediately know, because he would receive an alert from this smartwatch. So I'm not saying that this is what is going to happen. It might be well what may happen. And just think of what would happen to us pharmacists if we are not in this environment, digital environment. How can we help patients in this digital environment when they are going to be super well served? Maybe again, put these tools available to our customers, to our patients, and be in the loop. So just a few examples after Manjir's kind request of some digital tools that are already available in pharmacies around the world. Very briefly, Netcare, which is a telemedicine tool that is available in Swiss pharmacies. We were able to see it live a few years ago when we went to Switzerland with the FIP, and it works so well. So the pharmacist offers the patient, they follow a standard operation procedure, no just face-to-face with the patient, regular care. So if in that procedure, they might notice that the patient needs a medicine that requires a prescription, they might offer the patient the chance of having a telemedicine interview with a physician that might issue the prescription, and the patient might have that prescription dispensed in that same pharmacy. So it's a kind of one-stop clinic, and it works so well, and it's so efficient and so convenient that some health insurance companies offer a discount to patients that go first to a pharmacy instead of going to an emergency department, which is, of course, very much more expensive than going to a pharmacy. The second tool is Guildcare, which is a tool developed by the Pharmacy Guild of Australia. So this tool automatically checks, they have electronic prescriptions in place. So they check if the patient gets a refill every time they should get that refill. For example, if the patient is receiving one dose of one blood pressure medicine, for example, amlodipine, 10 milligram per day, and they have been dispensed 30 pills of that, they should come back at least 30 days after that. So if the patient does not come to any of the pharmacies in Australia in those 30 days, the system pops up an alert, and a pharmacist from the guild, not the pharmacy in the pharmacist in the community pharmacy, a pharmacist in the pharmacy guild calls the patient and checks if there's any problem at all with the medicine or whatever. So this is paid by medicine drug companies that want patients to be adherent, so they keep buying their products. So they pay guild, the pharmacy guild, and the community pharmacies to use this scheme. Aspen RX Health is called the Uber of pharmacy. So pharmacists enroll to this digital health tool, and they have conversations with patients using smartphones like a telepharmacy tool. But as with Uber, they receive stars from the patient. They have reviews from the patients, the customers, and they can maybe work 9 to 5 in a pharmacy and then work in this digital health tool. And after the request of Nigeria, I added some tools that I use in my pharmacy. I will try to have them covered for you. Just excuse me for a second. Yeah, here we go. So this is my pharmacy, and I'm using some digital health tools that are not related to digital health. For example, we have this kiosk in place, and customers can come and buy beauty products. We are not allowed to sell medicines through this kiosk, and I don't like that because I prefer to have my patients engaged with my pharmacist before they are dispensed. But they can buy this without having to wait the line, and they can collect that later. And it's much cheaper than in my pharmacy because this is connected to my e-commerce, and prices in their internet are a little bit more cheaper than in my pharmacy. Then I use this customer review tool, which is very simple. I'm sure you have seen that, but it offers me a complete review of how customers feel, because after they press any of these signs, how was our service to you today is the question that is here. And then they are asked specific questions, including what member of the staff engaged with you. And we put here pictures of us, including me, of course. And I have a complete review of how the customers feel they are being served. And I also use this tool just to take care of cash. My staff and myself use this machine when we are paid with cash. We put the money here, and the machine gives us the exact change. And this is not only safer, but it's very efficient because it saves me a lot of time when counting the money of the pharmacy, the cash. It's super efficient, and it's saving at least 30 minutes per day of our time, which is a lot of time at the end of the year. And then more related to digital health, I recorded the app we are providing our customers with. This is my phone, and I wanted to show you some tools that we are using with patients. This is my tool. This is my app, the one that I offer my customers. Here they can enter general advice about how to take care of their pets, how to why mother milk is better than baby formula, etc. Not very complex advice. And they have also nutrition advice. It offers our customers with the chance of texting with our pharmacist through this tool. Of course, we use WhatsApp at the same time, and my staff are instructed that when they receive a clinical query, not to answer through this app, maybe calling the patient by phone and asking them to come here to have a conversation, or maybe having a conversation through the phone is enough. But I feel that this is not enough information for us to advise patients, but it's good to be available for them. We also offer our customers with the chance of recording the weight of their babies, of their children. So this test, and the mother is, imagine that she's introducing in the system that her baby weighs 7 kilos the 8th of August. So the beauty of this is that not only it allows them to record the weight, but it offers solid evidence-based percentile. So the mom or the dad, the family, the carers have a good understanding of how the baby is evolving. In this case, the baby is going from maybe percentile 30 to below percentile 3. So this is an alert for their carers, and I'll also receive an alert in the pharmacy about this customer, this patient. It also offers the chance of recording blood pressure, weight, oxygen, glucose, and cholesterol. It offers the same percentile. The records you can see here that the patient is having not a very well-controlled blood pressure. So if it goes above, if it's in this red band, I would receive an alert in my email, so I can contact the patient to be sure to have a conversation with the patient to see what's going on and to help him. This is connected automatically with some devices. They can introduce it manually, but it can be connected with their devices, so it's automatically uploaded. So it works, I think, pretty well. And I think this is all of it. Oh yeah, we also offer our customers with nutritional advice, so they can book their appointment through the app. This is a regular appointment app, so it's very convenient for them. The other example I wanted to show you is my dispensing system. It should be available. I left it. I'm sorry. Just a few seconds. Yeah. So this is the dispensing electronic dispensing system that we use in the pharmacy. This is me dispensing myself a medicine. So what the patients come to us with their insurance card, which is this one. This is mine. So we pass the magnetic band, and we are automatically into the electronic dispensing system, and we see the prescriptions that the patient has available. In this case, in my case, I suffer asthma, and I'm with salbutamol and Symbicort, which is a mixture of corticoid and a long-term beta agonist. So I'm going to have my medicine dispensed, so you can see it. So I enter the system. I scan the barcode of the medicine that I'm going to dispense the patient. And this is very different to what was happening before this system, because the system does not allow you to make a dispensing error, because if you're dispensing something different than the prescription, you receive an alert. Then you can proceed if you want to, but you receive that alert. So this is a complete game changer for us. It gives us a lot of peace of mind, and it has made our dispensing errors almost zero, which is a big change. Also, I would like to mention this funny A that you can see here in the system. This real-time track and trace system, because in Spain and in the whole Europe, every medicine box has a unique code that we deactivate once we dispense it. So this A tells me before dispensing that this is a legitimate medicine and it has not been dispensed before. So I can proceed to dispense. And after I dispense it, it cannot be dispensed by any pharmacy at all, including my pharmacy. So it allows us to be sure that we are not dispensing a fake product. So it shows also the price and the copayment. In this case, the price of the medicine is almost 44 euros, and I'm paying 4 euros because of the public health system copayment that is in place in Spain. And then I'm sent to my, I say, dispense. I have advised the patient, I have a conversation with the patient, and it sends the prescription to my software to have the process of stock and payment to the patient, etc., etc. And I wanted to show you also a tool that we are using in Spain. It's called Luda. And it's an electronic tool that allows me to find the medicines that might be in short supply or that the patient does not want to wait that I have it serviced. So just very briefly, if the patient asks for a medicine I do not have in stock, I put it in the system. This is me typing now. This is not a recording. Then it looks for the medicine that I might be looking for. In this case, I will look for this Symbicort, for example. I add it to the basket, and I ask the tool to have it to tell me what closest pharmacy has it in stock. So the patient can go directly to the pharmacy that has it. These are all the pharmacies that have this specific medicine around me, the closest ones that have it in stock. So I can tell the patient to go to one of these pharmacies directly. And again, this has been a complete game changer for us, because the patient, instead of going from pharmacy after pharmacy, can go directly to the pharmacy that has it in stock. And this is it. This is all my presentation. I'm ready for your questions. Just if you're interested in digital health, there's an FIP report available. You have the QR code there if interested. And thank you for your attention. I'm ready for your questions. I hope it was interesting.
Thank you so much for such a productive and an informative session, sir. It was extremely helpful, and indeed you're an amazing speaker.
Thank you.
So, dear participants, if you have any questions to ask Mr. Jaime, please type them in the chat box or in the Q&A box. And I will now call upon Mr. Raj Vaidya, immediate past chairperson of IPA Community Pharmacy Division, to take up the Q&A session. Over to you, sir.
Thank you, Likita. Just recovering from a mesmerizing presentation. Thank you so much, Jaime. Really wonderful. It is indeed a pleasure to hearing it actually from you. Some questions are already coming in, and one of them is, how do we find time to adopt such technologies during our busy practice? Do you have any strategies to suggest?
Yes, this is a very good question, because normally in pharmacy, we are excellent community pharmacists, nothing else, but nothing more. We are not technology experts. We might not have the economic resources that many times are needed to have these tools developed. But I would suggest you going to the ones that have the expertise and the resources that might be, for example, your pharmacist association. For example, in Spain, our pharmacy association has developed some very good digital tools. And in my case, I'm involved with a wholesaler, which is a cooperative, and they are developing the tools, some of the tools that you saw. For example, the app is being provided to my pharmacy by this wholesaler at a fraction of the cost that it would take me to pay in the free market. Also, my e-commerce. So I would suggest you to doing the right partnerships with the right partners.
So it would be cheaper to have something like the association creating such apps so that they can give it at lower rates, rather than each one making their own app or own digital tool.
Yeah.
Yes, thank you so much. Any other questions?
Raj, first of all, it was a great, lively presentation, and you gave so many examples, and I think Raj used the right word, mesmerizing. So thank you very much. And I think there are some questions, Raj, from here. Jaime, there is a question. Can you recommend us with any cutting-edge technology companies in healthcare where we should try to collaborate? Or you have given some examples, but then again, some questions.
Yeah, I'm not familiar with the healthcare environment, digital healthcare environment in India, but I'm sure, as in Spain, there are many digital health companies around. Some of them are directly marketing already their tools to pharmacies, but it might be good, again, as a suggestion, if you want to consider it, to have them developed by the Indian Pharmaceutical Association. It's a very innovative, very big association, and you have, as I was introduced to before this conversation began, to some digital health experts that are very well aware of the needs. This is very important, of not only patients but also community pharmacies. And I'm sure, developing a digital health tool, I advise a few digital health companies in Spain, and I know it's sometimes a complete pain, but the result, if you get to develop a good product, is always much better than what you can find in the market. That's my suggestion if you want to consider it.
Yes.
Good advice.
Or telepharmacy, telemedicine, etc. To what extent is it legalized in Spain, or is it legalized? Because here the questions which are coming up is, how legal is it in the country?
Yeah, COVID has changed everything in Spain, as in the majority of countries. We are beginning to use some of these schemes, especially by hospital pharmacy, because we have like a professional competition to service chronic outpatients. and they are getting more and more into outpatient arena. And they are, as I'm sure it happens in India and other parts of the world, they are dispensing very expensive medicines that maybe do not need a complex treatment. They are not very complex medicines that would require having them dispensed in hospital, and I would agree with that. But because they are very expensive, our government finds an efficient solution to buying them instead of letting us dispensing, buying them before, if I explain myself well. So when the COVID pandemic began, we wanted to service those patients. There was no reason having them, forcing them to go to a hospital, maybe having a 3-hour time transportation through public transportation, which was very bad. They are sometimes not in good health, exposing them to COVID. So in some regions in Spain, the regional governments allowed community pharmacies to dispense those medicines. So they opposed to us developing telepharmacy solution. And some pharmacies in Spain are using that, but they are not being so useful because we have a lot of community pharmacies in Spain because of our regulation. We have a medium amount of patients per pharmacy in Spain is around 2,000 people. So if you compare that to other countries that might have maybe even 20,000 patients per pharmacy, we have pharmacies everywhere, as it happens in India. So it's not that useful in Spain. And still we have to find the way how to monetize it, because if you interview a patient and then you do not dispense the medicine, or the patient has it dispensed in another pharmacy, you're investing your time and not receiving any income, which I want to have it because I'm a pharmacy owner. And I participated in some schemes, and that was one issue, having that monetized. And the other thing, other difficulty I found was being able to service those distant patients when we were so busy dispensing our physical patients. So we need to have appointments, offer appointments to those patients that sometimes did not work very well. That's my experience.
Yes, thank you. Very well explained. There is a question related to hospital pharmacy. I think based on your experience in Spain, you could help answer this. What significant changes will be taking place after introduction of telemedicine in India in the hospital pharmacy setting?
Well, digital health is more than just telepharmacy, which is very important, but it offers the chance of maybe by using wearables, sometimes to have more data about how the patient is being. For example, using a smartwatch that measures 24/7 the blood pressure, you have much more data than just using a regular blood pressure device. So it offers convenience to the patient, because they also have access at any time the professionals they need, instead of going or booking appointments that might not work very well for them, maybe traveling long distances. And as I said before, also by having the medicines delivered to their homes. That's convenience. Patient convenience is a huge driver for patients, and they are also comparing us to what other products, Amazon. So when they buy something, they have it maybe in 2 hours, and they want to have that same service. What we need to be sure as healthcare professionals is that we can provide that excellent convenient service by being sure, again, that the medicine is going to be safe and efficacious, and there are tools available to be sure of that. So I'm not sure that we should oppose to delivery and to do some changes that the patient are asking us for, but we need to be sure that we provide the same service as with physical dispensing.
Yes, thank you. Now, the similar question is how to adopt such technologies in our busy practices. So related to that, I would like to ask, do these technologies save your time and make your pharmacists and your staff work better?
Absolutely, yeah. And I'm not talking about patient convenience and patient being better serviced. It's these are still very innovative in Spain, so we are a very different pharmacy to the ones that surround us. And when people come to us, they see things that are different, and that provides patient customer engagement. That's one thing, very business oriented. And it also saves a lot of money, a lot of money in terms when a patient wanted to book an appointment for the nutrition service, maybe they called on the phone or they came to us waiting the line and making other people wait. So they do it from their home, and they do not waste any of our time or any of the other customers' time. So it brings a lot of efficiencies. And also, it's more quality, because if someone called to book an appointment, for example, we had to enter the system by ourselves and then book that appointment for the customer. But we can make mistakes. If it's the same patient, it's you delete a step that might lead to a potential mistake. So it brings efficiency and quality and patient customer engagement.
So one is that you are digital savvy. That is one thing. Second thing is you invested some time and money into digitalizing your pharmacy by having tools. So that in turn is seen as an investment, so that you can get back more profits as well as save time. Is that it?
Absolutely. Yeah. Yeah. You said it very well. Very good summary. Yes.
There is one question from somebody. Any thoughts on Neuralink?
I'm sorry?
It says Neuralink.
Neuralink.
I quickly checked on Google. It says breakthrough technology for the brain. If it's not associated, then I think
I'm sorry, I do not know.
It's not connected to the context.
Okay.
And one question to you, Jaime, as we are digitizing our pharmacies and pharmacists are becoming digital health experts, how much change do you see in your education system? Is it incorporated in your education system at undergraduate level? Are you having more weightage for such newer technologies? And you also have an experience as in developing a training module or a curriculum on this. So please share that.
Yeah. So as a practicing pharmacist, I've been learning on my own. I've also, not only by what I do in my pharmacy, but also advising some startups. And it has been a lot of fun and a lot of learning for me. But I also, as you said, I'm engaged. First thing, I'm engaged with the FIP, trying to develop a masterclass for educators who want to include digital health contents in their pharmacy schools, whatever that pharmacy school is in the world. And I'm also developing a digital health master's in a pharmacy college in Madrid. And hopefully we will begin this September with the first students. And it's I wanted it to be very practical. So we have digital health experts from all around the world taking advantage of these technologies too. And we really need to have this knowledge in community pharmacy. It's not only because we need to serve our patients better, and technology brings many advantages to that, but also in terms of business. We need to be in the loop. Otherwise, we're out of business.
There's a question from Philippines. I am from the Philippines. With such advanced technology other countries have, how would we be able to cope up with these strategies? I would love to share this with my community.
So how to adopt these technologies? Is that the question? I'm sorry.
How would we be able to cope up with these strategies?
To cope up with
advanced technologies like other countries, or for example, what you have presented?
Well, in the Philippines, they are very well developed in terms of telepharmacy. They are using telepharmacy and e-commerce at a very big volume, I believe. We were able also to visit with Ms. Garan a few years ago. We visited Manila, and we were offered some examples of how they are using telepharmacy, and they are very well advanced. I was surprised. not surprised. I was very, very happy to see that, because it was also very quality oriented, and there are always things you have to do. It doesn't matter how different your background or your situation is. There are always opportunities with technology, not by technology by itself. It's a very important tool that allows us to serve our patients better.
Yes, digitalization makes things easier for us. So I think we have to use the technologists, the ones who produce these apps and digital things, so that we can use them in a simplified way, rather than we trying to learn these.
Yeah. And also, just if you allow me, I'm sorry I interrupted
Sure,
you.
please.
I did not go much into it because I wanted to provide practical examples, and it's not yet very much developed. But pharmacy is very data rich. We have a lot of data in terms of products and patients. And big data and artificial intelligence is going to be a huge game changer for healthcare, because we are going to be able, as if you remember the example I put about gene, they are going to detect illness or worsening because any symptom at all. So that is going to help us to provide a service more oriented to prevention rather than to curing illness. And this is going to change everything. And we really need to put both hands into that, using the data that is already available for us, and connecting and developing the tools that will allow us to change our practice. Sorry for the interruption.
No, not at all. It's all yours, actually. Thank you so much for such a vast amount of information and insights into technology. And I'm sure all the participants are eagerly sinking in still what you have shown us. There's a long way to go for us, and learn and absorb so many things. And I think we at the Indian Pharmaceutical Association will take your advice and see how best we can do it. And actually, it's this particular webinar is actually, it's under our working group, Go Digital. We have put one step ahead, and with such wonderful advice and presentations from you, we can definitely go ahead. As some participant has said, speechless. So if there are no more questions, I take this opportunity on behalf of IPA, CPD, and the Students Forum to thank you from all of us here and the participants for your wonderful presentation, for the time that you have devoted, and the simplified manner in which you have explained everything to us. And we look forward to your continuing guidance in the future, both through FIP as well as we at IPA will look forward to you time to time to get some tips and share what we try to do in the digital age as well.
My pleasure. I'm fully available to you anytime. Thank you
so much. As we draw close to the end of this webinar, we would definitely like to get a feedback from all of you, all the participants who have been listening in, tuning in. And as we post the feedback link in the chat box, please do click on it. And are we ready with the feedback link? And please do send in your feedback. Also, do join us in becoming member of IPA. Do follow us on our social media channels. Also, to inform you that this recording of this particular webinar will be available on YouTube through the IPASF YouTube channel. You can watch it and re-watch it so that you can, in slow motion, you can see and absorb much better way, so that you can put the ideas that have come forward to us into actual practice step by step. And of course, please do not forget to tune in tomorrow. You can register on FIP's website, because tomorrow Mr. Jaime will be moderating a seminar, which is a series of FIPs. It's shaping the future of self-care through pharmacy. This is one of FIP's series, and tomorrow's topic is self-care in digital age. All of you can join in here, register here, as well as you can watch it later on also if you miss it. So tomorrow it's at 4:30 p.m. Indian Standard Time, and I think today's webinar was a baseline, a stepping stone, and tomorrow we can see more professionals sharing their ideas and their experiences. So as we draw close, I thank each one of you for participating in this webinar. Thank you for your questions. Please spread the word around that the YouTube link of to watch this webinar again is available at IPSF. Thanks once again, Mr. Jaime, and thanks to all our colleagues at IPSCPD, and especially the people behind the scene who are the real technology wizards on whom we depend to run these webinars. Thank you all, and have a nice day ahead. Bye-bye. Thank you.
Bye-bye.